Welcome to everybody that made it to our hangout. This is our third hangout, and I really appreciate everybody joining us. I'm Patricia Smith, and this is brought to you with the help of the fine folks at The Designs. Anyway, just to tell you a little bit about the talk we're doing, we're talking about LASIK today. Who should have it, why you should have it, where you should have it. A little bit about me. I've been in Raleigh since 1991. I established this practice, Triangle Eye Physicians, in 2002. I'm a fellowship-trained cornea subspecialist, and I've been doing LASIK since 1996 at 2 a.m. in Monterrey, Mexico, but that's another story. I'm going to tell you briefly about LASIK, and please type in your questions as we go along, and we'll get to them. Probably at the end is the best thing to do. So first thing, I'm going to talk about why have LASIK. Certainly everybody out there has heard about this, so I might be preaching to the choir, but mostly you do it for everyday reasons. You get out the door without the contacts or glasses. You don't have to take all that stuff on the trip. So every day you wake up, and at least initially people just say, this is the greatest thing. And I'll tell you myself, I've had this surgery, and I think it is the greatest thing. But not just for every day. Do it for the things you are passionate about, the vacations, or the travel, or other things that are just icing on the cake. Your vision is part of your life every minute of every day. So I think that why doing this is a lifestyle choice is just a wonderful type of thing to think about. But what holds people back? Well, the number one thing that holds people back is the consideration of safety. You know, you see some awful stuff in some of these places online. And I think that the risk of this surgery has to be balanced with the advantages of the lifestyle gains, but also, say you're a contact lens wearer. If you look at that alone, some studies have shown that the contact lens complications are greater than the complications you face with refractive surgery. Some of the best studies are several years old, but it shows that the risk of infection, downtime, is actually greater with contact lenses, especially if people don't take care of them. And nobody that I know are absolutely perfect with their lens care. Now, granted, some of the more recent types of contact lenses, the safety profile on those is pretty darn good, and also the contact lens solutions have been improved. So this comparison, LASIK versus contact lens, might not be so, one-sided for LASIK as it used to be, but it's certainly a consideration. So if you're wearing contacts, well, you're already putting your eyes somewhat at risk. The other thing that will stop people is the cost of refractive surgery. And by refractive surgery, I'm talking about LASIK and the all-surface correction, PRK. The cost of surgery will put people off. They're just waiting for it to fall, I guess. But it won't, because these machines are very sophisticated, and to maintain them in top condition, does take some money. So, look around, but the cheapest person to have it with isn't necessarily the best, and I think that it's really a good idea to compare the overall costs, travel and time, and will they stick with you if you do have a problem that they need to get you through. So the other thing you have to think about in terms of cost, contact lenses have a cost. If you think about the lifetime cost of contact lenses, think, ballpark $300 per year for lenses. And of course, that can vary depending on how long you wear them, whether you should or not, what type of contacts, hard, gas perm, whatever. Plus, their fitter makes you come back for, let's just say $100 per exam. And when you think about all that, you may be ahead after 7 years of having had your refractive surgery. You're already ahead of the game in terms of the money that you spent. Never mind the time that you spent going to the practitioner for your examination, picking up the lenses, and everything else. Now, the business case for glasses, it's estimated that people buy about 15 pairs of glasses in their lifetime, and the business case for glasses versus LASIK, excuse me, maybe not quite so clear, but you still have that consideration of convenience, and you know it's very tough to put a monetary cost on it, but you know what it means to you. So, who has done refractive surgery? I love this photo. It's a Time magazine cover from 1955. But who's done LASIK? Well, lots of people. It's estimated that at least 30 million people worldwide have done it since the early 1990s. The very first refractive surgery using the excimer laser was in the called the late 80s. But lots and lots of people have it done, and it's extremely sophisticated now. Another thing to ask is who should not have it done. People should be less than 60 years old. After the age of 60, you start getting into problems with non-stable refractive error, that is glasses prescription, because early cataracts start to move that around. You may not get your full money's worth out of it. Who else might not have it? Someone who is under the age of 18 may not have a stable correction, not know what they're getting into. That being said, I've had some very mature 18, 19, 20-year-olds, say in the ROTC program at NC State, who were paying for their own surgery, and they did absolutely great with that. I think it was a boon to these kids. So there is an age range over which I think it's a good thing. There are people I would exclude. Who else should not have refractive surgery? I mentioned that the glasses prescription needs to be stable, and other conditions are screened for at the time of evaluation. This is an extreme example, but a cataract, you can see that whitish color behind the iris. That's where the crystalline lens, normally clear, resides, and this one's cloudy. So obviously that person shouldn't be thinking about LASIK. They should be thinking about cataract surgery. Who else shouldn't have it? One condition that's not totally common is keratoconus. Now, it's not uncommon either, but it shows up. It's a pooching out of the cornea. This person's looking down. You can see that cone curvature to the lower lid is being pushed out by the cornea, and people may not present with this keratoconus until their 20s, 30s, really their 40s, but it may be after they go and have some refractive surgery. So a lot of the testing that we do in the screening is meant to screen out people with keratoconus to try to make sure they don't have refractive surgery when they have this condition, because that also, you know, it may exacerbate keratoconus or tip them into something called ectasia, where it mimics keratoconus. Fortunately, that scenario for either way is very rare, because we look for that very diligently. Other things that should give you pause before your refractive surgery: any external problem on the eyelids, the eyelashes, the conjunctiva should be addressed first. Rosacea, allergy, dry eye, that should all be taken care of before the laser ever hits you. I want to make a special note about dry eye. You'll read about, oh, and let me back up here. The cost for the the cost of the screening is zero at this practice. So all these things that we're looking for to make sure you're a good candidate, we do not charge for that screening. Okay. What I was going to say is that during this free examination, I said we're going to look for dry eye. Dry eye is kind of a lazy diagnosis. Most people that are of the age looking at laser correction, they say, oh, I'm dry, that's why I can't wear contact lenses. Most young people that age have something else going on. It's either medication effect or rosacea or maybe allergy. That needs to be cleared up, but most people don't have true dryness, and my job is to make sure that if they do have intolerance to contacts, okay, why is that? That needs to be addressed before I go and apply the laser. Dry eye after refractive surgery has gotten a lot of attention because the older ways of doing the refractive surgery, doing the LASIK, where a blade was used to cut 130, 160 microns into the cornea, impacted the corneal nerves at a level where they do grow back, but they may not grow back completely at that level. Dry eye induced by LASIK has been much, much improved because the all-laser LASIK, and we'll go into that in a second, does not cut the corneal nerves at that level. And I have yet to see a patient truly long-term dry eye from the all-laser LASIK. The surface version of LASIK, where no flap is made, and we'll look at that again in just a minute, PRK, photorefractive keratectomy, does impact the corneal nerves on the surface, but by 60 to 90 days post-op, those nerves are back functioning well, and the nerves are critical to the wetting signals that go on the surface of the cornea. So dry eye as a sequela of refractive surgery is much, much less important if you take care of some conditions beforehand and either do the all-laser LASIK or stick to the surface. So, you know, like I said, if you hear someone say dry eye, they need to go into more detail. They need to treat other things and not just say, well, you're dry, wet it up. It's not that simple. And frankly, people that are specialists in cornea, like myself, might not be a bad consideration to see someone for your ocular surface before LASIK. But once again, those screening tests and examination, we do not charge for that at this practice. So where should you have your surgery? Well, obviously I'm giving the hangout, so we're here right by the Art Museum at Triangle Eye Physicians, and you want to check out our web at triangleeye.com for more information and directions if you do want to make that appointment. I am a board-certified, subspecialty trained cornea specialist, and I've been in Raleigh again since 1991, but I've had a long, long experience with refractive surgery. I also do corneal transplants and lots of cataract surgery. Okay, move on. There we go. The lasers that are used in the all-laser LASIK, this is the Zemer. I like it a lot. This is a femtosecond laser. This is used to actually make the flap in LASIK. And we've got a video here that shows you how this is done. So when you're doing a LASIK where you're making the flap, the femtosecond laser is used to create these cavitation bubbles about 110 microns below the corneal surface. And then once this layer of bubbles is created, it's a simple matter to just get under that surface right there, right where the bubbles are making at. It's almost like a postage stamp where there are little teeny perforations. And it's exquisitely accurate and also less energy put into the cornea compared to some of the other machines out there, like the Intralace. The energy going into the cornea is much less, and these folks are very comfortable in the post-operative period. So once my flap is done, I just, with a blunt instrument, I just go and find the edge of that, and it lifts away, and it keeps those surface cells intact. And then once that is done, then the laser is applied to the corneal surface. The laser that I use to actually sculpt that cornea, and the cornea is that clear covering of the eyes, mostly water, is the alligator wavelight laser. This is an excimer laser, excited dimer laser, and this wavelength is taken up by the water in the cornea and actually vaporizes it in a cool manner. I've got a video of that as well. So we've got our flap up, and this alligator laser is a so-called flying spot laser. This is a little bit more of the flap making. So the flap comes up. Come on, flap. And once the flap is up, this flying spot laser is applied to sculpt the cornea in the 6 to 9 millimeters that overlie the pupil. And then the flap is replaced. Okay? Let's get one. That takes about 15 microns of tissue per diopter correction, and say for your typical -3 nearsighted person, that may take you 8 or 9 seconds. So the actual procedure is very, very fast. This is an example. Now, I get these people that don't want to flap. Here they're showing a well where a dilute alcohol solution is put in. Now, I don't do this. I don't like all that alcohol around, but it softens the surface. I use a sponge instead, but those surface cells are pushed away, so you're not into the stroma of the cornea, and then the flying spot laser is applied just like under the flap. This is PRK, photorefractive keratectomy, and after you're all done with this, instead of having a flap to replace, we've taken off the cells, so we're going to protect that area with a clear contact lens, and that is staying in place for about 4 days. All right, so just to recap, we have experience, 20,000 plus. I used to be medical director at LASIK Plus. You want excellent results. I mean, you want just stellar. 20/20 or better uncorrected, and in my last results that we looked at last quarter, it was 89% for LASIK, over 90%, 92% for PRK. Severe complications, loss of best corrected visual acuity. Haven't seen it in years. I'd like to have, I don't know, I don't want to give you a statistic there. I don't have one to give you. 0. Retreatment rate, where people were unhappy enough to want to redo it, less than 5% for either LASIK or PRK. This is a very, very nice technology, but again, you have to make sure you pick up any problems that might interfere with healing first. I like the Zemer femtosecond laser to make the LASIK flap. I think the Allegretto laser is still one of the best on the U.S. market and extremely fast. I don't want to talk price here. Check our website or call my coordinator, Rebecca Wright. I really appreciate your time and attention during our hangout, and if any of you have any questions, just go ahead and type them in there, and we'll try to get to them. All right. If there are no questions, you are a very well-informed group. Again, our website is triangleeye.com, and we do free examinations, free screening tests for refractive surgery. I would love to see you here at the offices of Triangle Eye Physicians. But thank you so much for hanging out with us today, and the hangout will also be accessible again on our website. So check it out, and again, any questions that you might have about your particular case, give us a call and I'll see if I can't help you out. Thanks so much. Goodbye.